Your knee has been bothering you a lot over the last few weeks. You went to your doctor's office and they got an x-ray. It shows that two bones are touching one another. You've heard other friends talk about bone-on-bone arthritis, and you're wondering what your next step is. You were told to consider a knee replacement. Is it time for your knee replacement? Folks, I'm Dr. Howard Lux. I'm an orthopedic surgeon in Westchester County, New York. I've been here online for nearly a decade between YouTube, my own website, and Twitter and elsewhere. I've provided actionable and hopefully evidence-influenced information to you that's easy to understand, and that's probably has a lot to do with why I'm still doing it. Today we're going to talk about, do you need a knee replacement? Is it time for your knee replacement? Who decides when it's time for your knee replacement? So a knee replacement is done primarily for osteoarthritis or severe arthritis of the knee. Now it could be rheumatoid arthritis or what we call inflammatory arthritis. However, for the vast majority of you, this is performed for osteoarthritis. Osteoarthritis is simply loss of the cartilage or the cushioning between the bones. That's why your x-ray showed that the bones are touching one another or nearly touching one another. Now, does everyone who has bone-on-bone arthritis need a knee replacement? The answer is a very clear no. Why is that? Well, we do not treat x-rays. We treat people. What does that mean? I've seen hundreds and thousands of people every single year, and I'm constantly amazed that the x-ray, that what I see on the wall, does not necessarily represent or jive with the pain that you're complaining of. That means that I might see one of you with pretty mild arthritis or minimal loss of cushioning, yet you're miserable, and nothing we do to your knee makes that pain feel better. Then there are those of you who have horribly severe arthritis. There's not a cartilage cell left in your knee. The bones are touching everywhere, there's bone spurs everywhere, yet you get around. You're tolerating all your activities of daily living. You do not require a cane, or maybe you do, and that really doesn't bother you. You'll take a Tylenol on occasion. So which one of those two people is most likely to opt or decide to proceed with a knee replacement? See, this is a quality of life procedure. A knee replacement is not an emergency. It's not something you must do. We are not treating the arthritis on the x-ray. We're treating you, a patient who happens to have arthritis. So you're the one who determines when a knee replacement needs to take place. Now, there may be a few of you with severe deformities and other things that may make a knee replacement better if it's done sooner rather than later. But for the most part, we're talking about the 95% of you that don't have inflammatory arthritis, that don't have profound deformities and need to make a decision sooner rather than later. So you are the average person who comes in our office with a nagging, aching knee. So there's things you need to understand. A knee replacement is not without risk. It is not a small procedure. Upwards of 10% of people who had a knee replacement regret having it, despite the fact that the knee replacement was done well. Complications occur even in the best of circumstances. The only surgery without risk is a surgery on someone else. The risks of a knee replacement include infection. That risk is less than 1%, but it's not zero. And when an infection occurs, it can be a nightmare. There is a risk of blood clots. More recently, we've learned that there are a lot of people who may have an allergy to metal. You may not know it until the knee replacement is put in. And then if you're found to have an allergy to metal, they may need to remove the knee replacement and put in a much more expensive ceramic component. No, we can't put ceramic components in everyone because it's just, from a cost perspective and a population health perspective, it may not be worth it. We don't really know the answer to that yet. So let's go back to when you should consider a knee replacement. A knee replacement, above all else, is a quality of life procedure. That means you're going to wake up one day and say, you know what, I'm done with this. I can't take this anymore. I've tried physical therapy. I've tried injections. I even wasted my money perhaps on stem cells. You've tried many different things and nothing's worked, and you're miserable. You can't get through the supermarket without leaning on the shopping cart. You don't want to go out at night. You don't want to go up and down the stairs at your house, so you minimize those trips to those you absolutely have to take, to perhaps head to the bathroom or put your laundry away. You've started to notice that you're not going out with your friends as much. You're not going walking at all. Arthritis affects far more than your knee when it's really severe. It starts to affect your emotional and psychological well-being as well. You become lonely and depressed, and that really can start a downward spiral. So we'd like to proceed with knee replacements before you start that downward spiral. So it's very important to sort of key in and listen to yourself, and keep a book, keep a list, something of how you feel every day and how many days out of each week or month that you felt that the risks of surgery were worth the potential upside and benefits. When people do really well with their knee replacements, they do really well and they're very happy, and many wish that they had them years before they actually did. But because there are risks, because 1 in 10 is really not happy, you want to wait. You want to wait until it's time. And it's not up to us as your surgeons to determine when your knee replacement should be. It's up to you. You're the patient. You're the one who's living with this pain and discomfort and functional limitations each and every day. So if you have severe arthritis, there's nothing wrong with trying physical therapy or perhaps injections and other treatments to see if they improve your pain. And if they do and your quality of life improves, then that decision gets kicked down the road anywhere from 6 to 12 months, at which time you can repeat the same things. You should be exercising. You should be participating in physical therapy or some form of community program. Loss of muscle and strength is the #1 cause of frailty and demise. So keep those muscles strong and your knee will feel better. Your arthritis is not going to get worse because you exercise. Your knee is going to feel better if you exercise. It may not the first 2 weeks, but after that, it will. So, when should you have your knee replacement? That decision is yours. This is a quality of life decision above all else. We don't treat x-rays, we treat people. So if you have severe x-ray changes and severe issues with your quality of life, then it can be time to consider a knee replacement. Otherwise, hold off, seek a second opinion, talk to your family members and friends, and then make an informed decision. I hope you enjoyed this video today. Please click subscribe down in that lower left corner so you can get these videos as soon as they're posted. Feel free to recommend topics for further videos as well. Talk to you soon.